Hello everyone, I'm Dr. Sarah Shedat. We will talk about febrile seizure for today. First of all, what is febrile seizures? So for the seizure, it's uncontrolled electrical activity between the brain cell, which is called a neuron or nerve cell that causes temporary abnormalities in muscle tone, in behavior, sensation, or awareness. And from the name, febrile seizures, it's an seizures caused by fever. So the seizure in child without a previous febrile seizure, without significant neurological abnormalities, and without sign of CNS infection or metabolic disturbances. And it's usually occur between 6 month and 6 year of age. The reasons of febrile seizures. Many simple infections can cause febrile seizures, like influenza, like parvovirus, like Roseola infantum, which is the sex disease. Also, many vaccination can cause febrile seizures, like MMR, but you should take care that MMR does not cause epilepsy. For the febrile seizures types, we have two types. The first one is simple. If the seizure is generalized, also it should be less than 50 minutes, mostly seconds, and no more than one in 24-hour period. And for the complex or for the other type, it's a complex seizure or complicated seizures. If any of the following features are present, the first one, it's a start focally with one body part moving independently of the other and last more than 15 minutes and occur more than once in 24-hour period. What tests need to be done? So the most important question that needs to be answered in a child with a febrile seizure is what is the cause of the fever. Even if the fever is over, any young child who has a seizure with fever should be seen by a doctor to make sure that they don't have a brain infection like a meningitis. So your doctor will ask a question about any symptom suggestive of infection and perform a careful physical examination to look for signs of infection. Blood test may be needed. Also, a spinal tap may be needed in some cases if your doctor is worried about meningitis. That is done more commonly in children less than or under 12 months of age, mainly also less than 6 months of age, but rarely is needed in older children. Also for the electroencephalogram, which is EEG, and for the magnetic resonance imaging, MRI, are not needed most of the time. These may be done when a seizure is very prolonged, if the seizure begins focally, or if there are any concern on examination. How are febrile seizures treated? So febrile seizures cannot be prevented by giving the child baths and a lukewarm bath or applying a cool cloth to the child's head or body or using a fever reducing medication like acetaminophen or ibuprofen. So doing these things may make a feverish child feel better, but they don't prevent febrile seizures. So during a seizure, if the seizure less than 5 minutes, place the child on his or her side on a protected surface and watch carefully. Just observe. So if the seizure is more than 5 minutes, you should call emergency. And most children who have febrile seizure don't require daily treatment with seizure medication. However, children who have a history of prolonged febrile seizure and those who live in more remote areas with poor access to prompt medical care should be given a rescue medication, which is only used in certain situations like seizure more than 3 to 5 minutes. Is the chance of having another febrile seizure among children who have their first febrile seizure before the first birthday have will have at least one more. Among children who are older than 1 year, when the first seizure occurs, about 1 in 4 will have more. What is the chance of having epilepsy in the future? There are many risk factors for developing epilepsy later. The first one, problems with a child's development before the first febrile seizure or before the febrile seizure. Second one, having complex or complicated febrile seizures. The third one, there is a family history with seizures, the parent or brothers or sisters. So, how do these risk factor into the chance that my child will develop epilepsy later? If the child has none of these risk factors, the chances of epilepsy developing later are only 1% to 2%. There is very similar to the risk of developing epilepsy in any other child. Children with one of these risk factors have 2.5% chance of later epilepsy, and for children with two or three risk factors, their chance of developing epilepsy later ranges from 5 to 10%. And in rare cases, febrile seizures that last more than 30 minutes may cause a scar tissue in the temporal loop of the brain. So, in some of these children, chronic epilepsy unfortunately develops. Finally, I want to say that we have to live for a lofty goals and teach our children that. Please don't forget, like, comment, subscribe. Thank you all. Have a good day.